Living well. Living well really is the aim of any of the human being in our life, starting from any child patient to any adult growing patients. So what we'll try to do in our program is to give you the medical information in a very light meal and in a very simple way and language. We'll try to discuss about diseases, the causes of the diseases, the symptom of any disease, and then we'll finish by trying to treat or suggest any treatment for those diseases. So the aim of Living Well is not only yours, it's also our aim in our program to give you a very light meal of medical information in a very simple language. Hi there. We all know that any joint inside the human body will have many components. For example, the synovial fluid, the meniscus, the tendon, the muscle, or even the bony component of those, let's say, joints. Today I will talk about the fibrous part which usually link the muscle to the bone itself. So we all know that whenever we have a muscle that is attached to a specific joint, let's say, then those muscle group will need like a fibrous link that attach those muscle to the bone structure itself. So this is what we call the tendon. So in a very simple way, it's a fibrotic, let's say, band that usually it will attach the muscle to the bone itself. So those fibrotic band we call them the tendon. So any abnormality in the tendon, since they have a very highly flexibility rate and they are more prone to have any, let's say, injury, for example. So any cut on those tendon, it will affect the movement of the muscle or even affect the stability of the joint itself. One of the complications that usually it will occur for the tendon, it is what we call it tendonitis. Tendonitis, in a very simple word, it is the inflammation of the tissue of those tendon or the inflammation of the tendon. And most of the time, the inflammation of the tendon will be very painful and the presentation of the tendonitis will be in a very highly gradual rate, and it will affect not only the function and the structure of the tendon itself and the whole joint. So what are the, let's say, the people who are at risk of having tendonitis? Well, I've just mentioned them according to the sport that they will do. For example, like the tennis elbow, the shoulder pitcher, for example, the swimmer shoulder also, and the jumper knee. So any of those, let's say the elbow, the shoulder, the knee, usually the tendonitis will occur according to the activity that those patients will do. Most of the time, it is related to the heavy activity or heavy, let's say, sport that usually the person will do, like jumping or playing tennis or sometimes even the golf. So because they involved some of the joints. And the presentation of the tendonitis, the first thing that they will have, it will be severe pain on the site of the tendonitis, along with the abnormality in the function or even the movement of that specific joint, along with swelling and redness. And sometimes there will be an inflammation process that goes not only in the tendon, but in the whole joint itself. So as you can emphasize that the main reason for tendinitis, it will be a repetitive, let's say, movement that occurs in the same joint and in the same tendon, along with heavy activity or repetitive heavy activity in the tendon. So from that point of view, we can predict what are or who are the person at risk to develop tendinitis. Actually, athletics people or sports, let's say practical thing or practitioner, usually they will have a very high risk of developing tendinitis. People who have a very, let's say, repetitive movement involved certain, let's say, joints, for example, some sort of occupational hazardous injury that usually will occur, especially those people who use heavy, for example, machine to dig the roads, or for example, people who use their elbow or their shoulder to do a very heavy activity during a very long period of time. So according to that, we can suspect that tendinitis, usually it will be associated with repetitive heavy movement that usually involve one joint. What about the sport? What are the sports that usually involve tendinitis? Baseball, actually, it is one of the commonest sports that usually the player will have tendinitis. Tennis, for example, golf, swimming, and even sometimes, let's say, those tennis player or the squash player will have also tendinitis. So the severity of the involvement of the tendon and the severity of the inflammation usually will depend on the severity of the inflammation that involved the tendon. If it involved the whole tendon, then the symptom will be more severe and the patient will have the symptom, for example, like swelling, tenderness, paining, or painful joint, more than the person who will have a very mild, let's say, tendinitis. So according to that, deciding to go to the doctor, this is a very important step. Once you have, let's say, symptom that you cannot control by the painkiller or by a simple massage or by taking a rest or giving your, let's say, joint a rest, either the shoulder, the elbow, or the knee, then you need to seek a medical advice. How to diagnose tendinitis? One of the things which is very important is to do some blood workup. According to the blood workup, we can decide that the indicator for the inflammation, like for example the ESR, the erythrocyte sedimentation rate, or the C-reactive protein, usually they will be high. Along with that, the physician or the treating orthopedic might ask for some sort of radiological evaluation for the joint itself. And the most, let's say, precise way to decide the involvement of the tendon will be doing a magnetic resonance imaging. We all know that MRI, it is one of the most recent and the most developed, let's say, way to diagnose any abnormality inside any joint. But the most important thing is to be able to diagnose tendinitis by that way. One of the things which is very important is doing the physical examination. Actually, the physical examination, it is the most important step in diagnosing tendinitis, since that almost all the patients will have very tender joint, and on the physical examination, the physician will be able to emphasize the symptom of tendinitis.